I included Holland in there because Holland was really the start of the international movement toward physician assisted suicide. In 1971, there was a Dutch physician who killed her mother, who was terminally ill. And that really made Holland kind of an ethics laboratory for this topic, physician assisted dying. Um, Critics at that time saw the physician assisted deaths as accelerating a growing culture of death. And they at this around the same time they were in the process of legalizing abortion as well. So they kind of viewed this as promoting growing a culture of death and dying. In 1973, the Dutch formed guidelines for physician assisted deaths. And they said that only competent patients can request to die, that the requests have to be repeated, unpressured, and documented. The physicians have to consult another physician, and the patients have to be in unbearable pain or suffering without the likelihood of improvement. So, those were the conditions that the Dutch put in place to allow for physician assisted suicide. Now, what's interesting to know is that Holland has universal medical coverage, including long term nursing home care. So, these Dutch patients have probably been seeing their doctors and who have known them for many years. So the question is, did this create a slippery slope in Holland? Um, what happened was there's evidence that between about 1973 and 1990 that these Dutch physicians killed thousands of incompetent patients, which was a direct violation of their own guidelines. All of the patients were terminally ill, and most evidence shows that most of them had either cancer or AIDS. And when they were competent, they had asked the physician to help them to die. So they had gotten to the point of incompetence, but that's when the euthanasia happened. So their voluntary euthanasia, physician assisted suicide, did spread to the killing of incompetent patients. But there were some limits within those deaths. They had to have had a prior discussion with the physician, or they had to have an advance directive. If they didn't have either of those, then they weren't killed or euthanized. But there were some cases documented that did kind of push the limits. There was one included that was a physician killed a woman in her 20s who had suffered a decade of severe anorexia. So, that's a questionable one. And in 93, there was a doctor who euthanized a woman after the death of her two children, and the failure of her marriage left her depressed. So you can certainly debate whether there was the potential for improvement, and did these cases meet those four parameters that they had set forth in Holland. So it was in about 2001. So this was where there was the semi legalization of physician assisted suicide in Holland, that it became completely legal in Holland, and it had the support of 90% of the Dutch citizens. So Dutch law now includes the right of patients in the early stages of diagnoses like dementia, amyotrophic lateral sclerosis, ALS, to be able to sign advance directives so that they can be euthanized at a later date. What was interesting is that Holland really took it, and you can think about your own moral beliefs with regard to the situation, but they took it a little bit further and extended their euthanasia legislation to competent adolescents between 16 and 18 years of age who had the consent of their parents, as well. I'm sorry, 16 to 18 could consent on their own, and children aged 12 to 16 could consent with the consent of their parents. In 2006, they started a protocol where children under the age of 12, and especially babies, could be killed with parental consent. In these cases, there were two physicians who had to agree that the child was terminally ill, and there was no prospect of recovery, and that they were suffering great pain. But this protocol legalized what was previously happening secretly with babies in Dutch hospitals, and particularly with babies with spina bifida, which is a neural tube defect. In the most severe cases, they have a permanent impairment, depending on the level of the lesion. So that was the start. In other countries, they have legalized. You're going to explore that, or you already have explored that on that website, looking at where physician-assisted suicide is legal. Next, I've posted in Play-Doh the cases of Jack Kevorkian, who we talked about yesterday, and Dr. Anna Powell, and she was the physician with the patients in New Orleans at the time of the hurricanes. Just another a note here. I guess I'm going back in time again. The Hippocratic Oath, we've already talked about the Hippocratic Oath and how it is considered the origin of medical ethics. And in this document, it forbids physicians from killing patients. And one of the statements in the Hippocratic Oath is, I will neither give a deadly drug to anybody if asked for it, nor will I make a suggestion to this effect. Similarly, I will not give to a woman an abortive remedy. So that's one of the statements that's in the Hippocratic Oath. What's interesting is, it's often attributed to Hippocrates, but it's not really the work of Hippocrates as a single man, but a group of people who followed Hippocrates. And what was really most interesting about the Hippocratic Oath and the Hippocratic writings is that it wasn't really the prevailing philosophy at the time. At the time, the people believed, the Greek physicians in particular, thought that life had natural limitations. And beyond those natural limitations, it was only fools who tried to extend life. And the concept of that natural limit was infused within the Greek culture, especially in things like the theater, where death was often glorified and kind of exalted. The thought at the time was that any attempt to go beyond the limitations of what is deemed to be a typical life was arrogant. It was hubris. And it invited the gods to strike them down. So, if you're trying to live beyond or trying to find methods to extend life, that was arrogant, and you'd be struck down by the gods. So a lot of ancient Greek physicians actually did help their patients to die. So it's interesting that the Hippocratic Oath came out of this culture and at this time when it was contrary to what so many physicians were doing at the time. So we're going to look at some ethical issues related to this topic. In general, the concept of assisted suicide. You've now read the case of Elizabeth Bouvier and Larry McAfee. So one of the questions raised by those cases is, what was their intended action? Did they intend to commit suicide? Was it a rational suicide? Would it have been assisted suicide, euthanasia, a voluntary death? Considering some of those things. If we look at some of those terms, euthanasia generally means the killing of one person by another for a merciful reason. Those cases didn't involve euthanasia because in each case, the death would have been initiated by the person, him or herself. So you can't really classify those as euthanasia. Secondly, a terminally ill patient who doesn't get medical treatment isn't really committing suicide. We have to distinguish between cases where there's an underlying disease that's leading to the death by choosing not to do everything possible, the patient accepts death, and cases where a competent adult without a terminal illness causes his or her own death. The second one is a suicide. It's a competent adult without a terminal illness causes their death. That's a suicide. But in Bouvier and McAfee, they're best called assisted suicides because neither one of them had a terminal disease, but they couldn't also couldn't easily kill themselves, so they needed assistance. So one of the reasons it's important to make this distinction is because that insurance companies don't pay benefits for suicides. So, why didn't Bouvier and McAfee just kill themselves? Surprisingly, the answer is that it's really hard to do that when you have a disability, particularly to do it in a painless, aesthetically pleasing, and 100% certainty way when you have a disability. It's almost impossible to do that. Other misconceptions about suicide, there are many. It's hard to commit suicide with certainty. There oftentimes are errors, and those errors lead to not being successful, and then sometimes ending up in a vegetative state, or being surviving and then having to deal with all the issues that come with that. A lot of times people who do things like jump off the Golden Gate Bridge take medications to relax their muscles, which softens the impact. So there have been people who have survived that. There was a story of one jumper who actually hit a parked car, didn't die, and didn't even lose consciousness. So, there are situations where the attempts are not as successful. Taking using different medications and finding the right combination of medications is also a challenge and can leave people in comatose states and in vegetative states as well. Or people using other methods like carbon monoxide poisoning that doesn't always work. So people tend to think that, or people who are thinking about committing suicide think that it can be easy, but it really is challenging because there are errors that happen. They often try to spare the feelings of people so that they're found in a dignified state. So they avoid certain methods, but they don't realize that these other methods also have issues. There's no aesthetically pleasing way so that your family doesn't experience the distress. So that's kind of what I wanted to, the point I wanted to get to in this topic is that people who are thinking about suicide think that, there are some ways to do it that are better than others, or that are going to be less harmful or less impactful for the family. And that's a misconception, is that regardless of what they do, it is tragic, it is difficult for the family, and there's no good way to do it.